Okay, 12% of all running injuries are caused by IT band syndrome. That is more than 1 in 10 runners, and it makes IT band syndrome one of the most common running injuries in our sport. But here's the thing. It's not just about having a so-called tight IT band, and today I'll explain what IT band syndrome is, why it causes knee pain, and why stretching alone won't fix it. Hey, I'm Dr. Abby, a physical therapist who helps runners over 35 stay injury-free and get back to running pain-free. If you've ever had that nagging pain on the outside of your knee, or you've been told to just stretch your IT band, you're in the right place. Hit subscribe because this series will walk you step by step through recovery for IT band syndrome. What is IT band syndrome? Or what is the IT band actually? Let's go back to that. The IT band is short for iliotibial band. It is a thick strip of connective tissue that runs from your hip all the way down to the outside of your knee. Think of it like a seat belt or a tension strap. It doesn't contract like a muscle does, and it doesn't stretch much either. Its main job is to stabilize your leg when you're walking or running. Now, here's where the confusion comes in. A lot of people think, oh, my IT band hurts or it feels tight, it must be tight and I just need to stretch it. But the IT band isn't really designed to stretch. It's more like leather than the elastic like your muscles are. What is IT band syndrome actually? IT band syndrome happens when that strap rubs or compresses against the bone on the outside of your knee. So right here it comes in and inserts down and it rubs there. Every time you bend and straighten your knee, especially during running, that friction irritates tissues underneath, and over time the irritation turns into sharp or burning pain on the outside of your knee. That classic runner's ache that usually kicks in a mile or two into your run and gets worse with downhills, going up and down stairs, things like that. And a lot of times with cross training too, such as using the step machine or the spin bike can cause problems. That's why I've created a cross training for injured runners guide, and it's linked down in the description as well. But why do runners get IT band syndrome in the first place? Most of the time, the IT band itself isn't the actual problem, it's what's happening above and below it. In PT, we treat above and below a painful joint. Weak glutes, hips, poor running mechanics, and ramping up your mileage too quickly, they all put excess stress on the IT band. So basically, the band is doing too much stabilizing work because the muscles around it aren't pulling their weight. If you've ever jumped into marathon training too fast, added hills suddenly, or skipped strength training completely, you're really setting yourself up to IT band issues. So I said in the beginning, runners tend to just think that they need to stretch their IT band. And when I tell runners, just stop stretching, you're not doing anything, they want to know why. And the truth is, actually surprises most runners. You can't actually stretch your IT band. Remember, it's like leather, not a rubber band. Foam rolling directly on it may give temporary relief, mostly because you're pressing on the tissues around it, increasing blood flow, but it won't solve the real problem. That's why so many runners get stuck in a cycle. They stretch, they foam roll, they feel better for a day, they rest, but then the pain always comes back when they run. And if you want long-term relief, you've got to restore mobility at the hip and build strength to take the pressure off of the IT band. Hi, Nigel. All right, so now you know what IT band syndrome actually is. It's not just a tight band running on the outside of your leg, but the next step is to start with the right mobility drills that actually target the hips and muscles driving the problem in your IT band. And in my next video, I'll show you 2 mobility drills that you should start today if you've got IT band pain. Don't wait, rest is not gonna solve anything. Go ahead and jump right into these mobility drills. They'll start making a world of difference for you. And remember, they're mobility, not stretching, and there is a big difference between the two. So if this video gave you clarity, hit the like button so more runners like you can find it, and subscribe to catch the rest of the IT band recovery series. And if you're ready right now for a complete step-by-step plan instead of piecing it together on your own, check out my 12-week IT band recovery program for runners. I'll link it down in the description below, and I can't wait to see you next time for those 2 mobility drills. See you then.